Assalamu alaikum and very good evening to all of you. অনেকদিন পর আমি আজকে শুরু করলাম ENT fifth year lecture class. So we all are welcome to my fifth year class. Actually, before I discussed about the exam-oriented things very shortly, very briefly, which is very important for exam. But today actually is a classical lecture what we are giving to every medical colleges. So I try to deliver my lecture on that style actually. I usually speak or deliver my lecture in English, but I will say Bengali as well, so that you will have a clear idea about the things. Today's topic, nose, anatomy and physiology. As you know, nose is very complicated, but ENT is complicated. কিন্তু তোমাদের জন্য এক্সাম ওরিয়েন্টেড যে প্রশ্নগুলো আমরা পরীক্ষা দিই, মোস্ট অফ দ্য কেসেস কোশ্চেনগুলো আমরা মডারেট করি, তো আমরা জানি কি পরীক্ষায় আসে আর ভাইভা বোর্ডে আমরা কি জিজ্ঞাসা করি, ওই ওরিয়েন্টেডই আমাদের লেকচার ক্লাসগুলো সাজানো হয়, যেন তোমরা আননেসেসারি কোনো টপিকস নিয়ে বেশি এক্সাইটেড না হয়ে যাও। ভেরি সিম্পল ওয়েতে আমরা বোঝানোর চেষ্টা করি যে এইটুকু পড়লেই এনাফ ফর ইয়োর পাস, নট অনলি পাস, ইভেন গেট অনার্স মার্ক। So let us start with that. I will just say clearly, a bit slowly, because I am very fast sometimes, but when I'm very fast, please let me know. So nose, anatomy and physiology, I am Professor A Matin, working as head of the department. So it's all over the Medical College and Hospital, Dhaka. This is your syllabus. I think very small print. These are the syllabus for MBBS medical students from the BMDC. This time, actually, I changed some syllabus. I was appointed for the revision of the syllabus under BMDC. So there will be some change, but these are the syllabus: anatomy of the nose, physiology of nose, and then we'll start epistaxis, foreign body nose, fracture nasal bone. Another topic is nasal allergy, polyp, rhinitis. So we will go through these topics step by step. So today's topics, one lecture is anatomy, but I will finish anatomy and physiology of the nose. What about the embryology of the nose? We never ask this question in your exam. We never ask even in MCQ in your exam. But still, as you know, we have to have some refreshment of our knowledge from first year and second year, our studies, embryology. So as you know, this is a nose. So at the age of 4th weeks of gestation, as you know, there are primitive foregut orifice. This is called stomodium. And along the stomodium, around the stomodium, there are 3 projections coming up. One is frontonasal process, another is maxillary process, another is mandibular process. They fuse to form a face. And this frontonasal process divides inferiorly by nasal placodes, and they ultimately form the nasal cavity and primitive nose. So this is the anatomy. And all these arches coming from the first branchial arch. For your postgraduate examination, you have to know there are different branchial arches, 1st, 2nd, 3rd, 4th, 6th branchial arches. Individual branchial arches, what are the muscles, what are the nerves? This is very important for FCBS, FRCS, MRCS, or other MD examination to know the things. Like first branchial arch, muscles are muscle of mastication, and the nerve is mandibular nerve. Second is muscle of facial expression, and nerve is facial nerve. Third is stylopharyngeus muscle, and the nerve is glossopharyngeal nerve. So this you have to know. So for the nose, this is coming from the first branchial arch. That's it. Let us start with the anatomy of the nose. As you know, look at my nose. This is the triangular shape or pyramidal shape. For the description purpose, we divide the nose in 3 divisions. One is external nose, which you can see from outside. Another is nasal cavity inside. And in the nasal cavity, this part and the L of the nose. Inside is a skin-lined squamous epithelial lining with hair-bearing area, and that is called vestibule of the nose. So we divide the nose in three different sections. One is external nose, another is nasal cavity, and vestibule. Look at this nose. Can we recognize the face of this? Anyway, so this is the external nose, and the external nose has got bony part and the cartilaginous part, and they are covered by skin and connective tissue. So that is the external nose. So external nose has got bony part. What are the bones? If you just look at this face, this is the frontal bones here, and this is nasion. So there are two nasal bones here, two nasal bones attached with the frontal bone here. And from here, from the maxilla, the frontal process of maxilla is coming up here, and frontal process of maxilla coming up here. So the external nose, the bony part, consists of two nasal bones and frontal process of maxilla. These are the bony part. And now this part is the cartilaginous part, and upper part, this part is upper lateral cartilage, two sides, and this part is lower lateral cartilage. This lower lateral cartilage is called alar cartilage. It has got lateral wing called alar cartilage, and medially it has a crus which is from the columella. And this is the nasal aperture, and as you know, the inside the nasal cavity will come. So these are the external nose. So external nose has got two parts, cartilage and bones. So if you look at this picture, so this is the nasal bones, the frontal process of maxilla, and upper lateral cartilage and lower lateral cartilage. So this is important for your exam, for MCQ. Sometimes we ask this question. The following are the components of the external nose. So this we discussed, the external nose. The external has got muscles. There are 3 compressor and 4 dilator muscles, and the blood supply coming from the maxillary artery and ophthalmic artery, and venous drainage, enterofacial vein and ophthalmic vein. That means the blood supply is from the external carotid artery supply as well as internal carotid artery. The maxillary artery is the division of the external carotid, ophthalmic division of the internal carotid. And nerve supply is from the muscles are supplied from the facial nerve. Lymphatic drainage, the submandibular lymph nodes and preauricular lymph nodes. But for the exam purpose, we never ask these questions. Tell me about blood supply, lymphatic drainage of the external nose. We never ask this question. So we don't even need to know this. But as we are describing the anatomy, so you have to know. But this is not for exam. This is very important for your exam. That is a nasal cavity. The nasal cavity has got the roof, the floor, the lateral wall, the medial wall, and there is one part is the osteomeatal complex. This is very important for your exam. Out of this, for exam purpose, septum is very important. We ask this question in the exam. Draw and label nasal septum. How does nasal septum get blood supply? Or in the Viva exam, we usually give a piece of paper and pen. Okay, you draw and label nasal septum and show me how nasal septum get blood supply. Lateral of the nose is very important for MCQ as well, and also in written paper. Write and draw and label lateral wall. What are the components of lateral wall? How the sinus is drained. So this is very important. Osteomeatal complex is important for exam, for MCQ. Roof and floor usually never ask. So this is the nasal cavity. It has got the roof. This is the roof of the nasal cavity. And this is the floor of the nasal cavity. Remember, the floor of the nasal cavity is roof of the oral cavity. And the nasal cavity extends from the intranasal aperture or nares to the posterior corner here and is communicating with the nasopharynx and down to the oropharynx. Behind the nose is part of the pharynx, this one, and this is nasopharynx. And here is one opening. This is the opening of the ischiation tube. So lateral, this is actually cavity, nasal cavity, but this picture is lateral wall. So we'll start nasal cavity, roof, floor, medial wall, and lateral wall. This is the lateral wall of the nasal cavity. Let us start with the medial wall of the nasal cavity. It's called septum. And this is very important for your exam. We ask the question, draw nasal septum. It is very funny sometimes to see, my God, how they draw the picture. So always think of the nose. This is the bulging, this is the forehead or the frontal bone. So make a bulge from here, just draw this one like this, and then go like this. Let's just make a nose. And then one line here to the soft palate. And from here, draw a line this, and then going downwards for the sphenoid. So this is frontal, this is sphenoid sana, and this is the nasal septum. The nasal septum has got mostly anterior part is called quadrilateral cartilage. This is the cartilaginous part, quadrilateral cartilage, this one. And posterior superiorly, this is a bone called perpendicular plate of ethmoid bone. So how to first draw this one, and then from here, make an oblique line touching here at the middle part of here. And then another from here to here. And this divide the septum in three major parts. One is anteriorly cartilaginous part. It's called quadrilateral cartilage or septal cartilage. Perpendicular plate of ethmoid bone, and posterior inferiorly the vomer. There are some contribution coming from the nasal crest, maxillary crest, and palatine crest. So nasal crest of maxilla and nasal crest of palatine bones, and sometimes extreme posteriorly the rostrum of the sphenoid bone. But septum is very important for exam. And draw and level septum. Do this practice at your home, how to draw nasal septum. And this is a very diagrammatic picture I draw, okay? And practice this one. So quadrilateral cartilage, perpendicular plate of ethmoid bone and vomer, and minor contribution from nasal crest of maxilla, nasal crest of palatine bones, and rostrum sphenoid bone, as I said. Now, what about the roof of the nasal septum? Look at this roof. This is the roof. Now, what are the bones? You can see this picture. This is the nasal bones. So the roof is formed by the nasal bones, the frontal bone, as the frontal sinus is here. So this is frontal bone. Nasal bone, frontal bone, cribriform plate of ethmoid bone, and this is the body of the sphenoid bone. So the roof is formed by four bones. One is nasal bones, frontal bone, cribriform plate of ethmoid bone, and vomer. But we never ask this question in the exam that, okay, tell me how nasal roof is formed. We never, but this is for your discussion purpose. The floor is the palate. It's called hard palate. It has got two parts. One is palatine bone and maxillary bone. So the floor hard plate, palatine process of the maxilla, and horizontal process of palatine bone. This is the hard palate or floor of the nose. And the roof is by the four bones I described. But we usually don't ask this question in the exam. So limited to septum and lateral wall. And this is the main part of the discussion, the lateral wall. It's very complicated, lateral wall of the nasal cavity is very irregular, uneven surface, convoluted by three bulging, we call turbinates, and underneath the turbinates is a slit or spaces called meatai. So the lateral wall has got three turbinates and meatai. Now, this is a very classical picture of the lateral wall of the nasal cavity, just to surprise how nicely this picture is delineated, the cadaveric nose. After sagittal section of the nose, you can see how nicely the lateral wall is delineated. So the lateral wall of the nasal cavity is irregular, it's convoluted by three turbinates. This is the inferior turbinates, which lies along the whole length of the nasal cavity, lateral in the lower part, and above this is the middle turbinate from the posterior 2/3, and far above is the superior turbinate, the posterior 1/3. So the whole length of the lateral wall inferiorly is an inferior turbinate, posterior 2/3 is middle turbinate, and posterior 1/3 is superior turbinate. And underneath the turbinate is a slit. Inside this is the inferior meatus, the middle meatus, and the superior meatus. So this is a fantastic picture of lateral wall of the nasal cavity. You can also see the central section. What is this? This is the nasopharynx. Behind the nose is nasopharynx. Lateral of the nasopharynx, there is an opening of the eustachian tube. So this is the opening of the eustachian tube. This is the hard palate. This is the soft palate. This is the tongue and this oral cavity. How nice. This is the sphenoid bone. As I draw the picture, septum. So this is sphenoid bone or sphenoid, and inside the sphenoid is a sphenoid sinus. Sphenoid sinus. And here, the frontal bone, inside the frontal bone is a space. This is the frontal sinus. So the lateral wall of the nasal cavity has got three turbinates and three meatai. Sometimes patients may have extreme, another turbinate is called supreme turbinate or fourth turbinate. But I never saw any fourth turbinate in my whole life of endoscopic sinus surgery. I never. So these are the anatomy of the lateral wall of the nasal cavity. Now, if we pass an endoscope, because lateral wall of the cavity is very, very important for endoscopic sinus surgery, for your understanding of the anatomy, because it's very difficult. But if you just do like this is the endoscope. I pass the endoscope. We pass the endoscope like that way during endoscopic sinus surgery. Can you hear me? Hello? ও হ্যাঁ হ্যাঁ আমি তো শোনো, আমি ওই যে একটা ক্লাসে আছি, বুঝছো? আমি পরে ফোন দিচ্ছি তোমাকে। Hello. So this is the when I pass the endoscope to the nasal cavity, we see this lateral how it is. So this is the nasal septum. This is the inferior turbinate, and this is the middle turbinate. We usually deflect or displace the middle turbinate or push the middle turbinate medially to see the middle meatus. And here is a slight bulging of the bones, thin plate of bones attached from the superior surface of the inferior turbinate, and this is called uncinate process. And that uncinate process is cover the opening of the maxillary sinus here. And between the uncinate process and the middle turbinate, there is a bulging here. It's called bulla ethmoidalis. And now, once we incise the uncinate process, we see the space here. It's called infundibulum. And here you can see clearly the bulla ethmoidalis. Okay. And this is, you can see the opening of the maxillary sinus in the middle meatus. This is the, in the middle meatus, anteriorly and superiorly, this is the opening of the frontal sinus. This is the bulla ethmoidalis. We ethmoid yard cells. We break the enteroethmoid, and you can see now the dense plate of bone. This is called ground lamella. Behind that is your posterior ethmoid yard cells. Once we remove this ground lamella, we see the posterior ethmoid yard cells. And medial here, you can see the superior turbinate and the superior sphenoid sinus opening. This is the opening of the sphenoid sinus. But this is not for you actually. Now the lateral wall, as I said, the turbinates, is the opening of the maxillary sinus. This is the uncinate process. This is bulla ethmoidalis, and this is the middle turbinate divides. This part is called ground lamella. Is a part of the middle turbinate which divides the enteroethmoid and posterior ethmoid. This one. And we attach to the skull base and lamina propria. This is the frontal sinus. Now, what is osteomeatal complex? As I said, the lateral wall nasal cavity is very important osteomeatal complex. And that part in endoscopic sinus surgery is very important because there is this easy blockage of the osteomeatal complex causes recurrent rhinosinusitis. And this is a very complex anatomy because all the bigger sinuses drains through the narrow cleft here. So the osteomeatal complex comprises of maxillary sinus ostium, which is underneath the uncinate process here. So maxillary sinus ostium, then middle meatus, this part, uncinate process, bulla ethmoidalis, and underneath here infundibulum, hiatus similaris, and along the extreme anterior part of the middle turbinate here, and the axilla is the agonized cells. So these are the part of the osteomeatal complex. So osteomeatal complex comprises of maxillary ostium, middle meatus, uncinate process, infundibulum, hiatus semilunaris, bulla ethmoidalis, and agonized cells. These are the part of the osteomeatal complex, and this is important for your MCQ in Viva exam, in written paper as well. We usually ask this question. Now, how the nasal septum, how the lateral wall get blood supply? So blood supply of the nose is supplied from two divisions, the external carotid artery division and the internal carotid artery division. The external carotid artery division and the internal carotid artery, the internal carotid artery give branches to the ophthalmic artery. And from the ophthalmic artery, there are two branches, the enteroethmoid and the posterior ethmoid artery. They are coming up and they have lateral branch and medial branch. The medial branch is septal branch, supplying the septum, and lateral branch supplying the lateral nasal cavity. So draw and label nasal septum. How does it get blood supply? This is the picture. So try to practice this picture, which is very important for exam. The nasal septum is supplied by the enteroethmoid artery, the posterior ethmoid artery. One is coming up obliquely, sphenopalatine artery. One is coming from here, greater palatine artery, and from anteriorly is a superlabial branch of facial artery. So all these artery make anastomosis at the anterior inferior part of the nasal septum, and that part is called Little's area, and the plexus is called Kieselbach's plexus or Kieselbach's plexus. There is another plexus here, branch the sphenopalatine artery, and this is called Woodruff's plexus. These are the parts of the site of epistaxis or bleeding of the nose is mostly Kieselbach's plexus. So the blood supply of the nasal septum is from 5 different arteries. And this is a MCQ, this is a short essay question paper, Viva exam, Druan level septum, and how it get blood supply. So please practice this picture. Enteroethmoid, posterior-ethmoid, sphenopalatine, getapalatine, and your superlabial branch. And it has got lateral branches which supply the lateral wall of the nasal cavity. Same branches. So this is blood supply we discussed. What about the nerve supply of the nasal nose? So it is also septum and lateral wall. Again, the branches from the, as you know, the ophthalmic artery, entero and posterior ethmoid, similar name actually, the ethmoid nerves or ophthalmic nerves. So this is the ophthalmic division. This is the nasociliary nerve, or you can say enteroethmoid nerve and posterior ethmoid nerve as well. And these branch from the maxillary, like a nasopalatine nerve. This is the branches from the maxillary nerve. So basically, ophthalmic and maxillary division of the trigeminal nerve supply the nasal cavity and septum. Ophthalmic and maxillary division of the fifth nerve, trigeminal nerve, supply the nasal cavity and septum. And the secretomotor supply is from the nerve of the pterygoid canal. And especially the muscles of the or motor supply, as I said, is from the facial nerve, sensory supply with the fifth nerve through ophthalmic and maxillary division. Secretomotor for nerve of the pterygoid canal or Vidian nerve. And a special sensory supply is a olfaction or smell is called is a olfactory nerve here. So the nerve supply of the nose, it has got motor supply from the facial nerve and the sensory supply from the fifth nerve through ophthalmic and maxillary division, secretomotor supply by Vidian nerve, and smell by olfactory nerve. So there are 4 different types of nerve supply in the nose. Lymphatic drainage of the nose is not important. Nerve supply is sometimes important. We ask this question, but lymphatic drainage is usually not important, but important for the cancer patient as we are dealing with cancer. So the inner part of the nose drained to submandibular and upper deep cervical, and posterior part of the nose is from the posterior part is coming to the deep cervical. What about the epithelial lining? The nose has got 3 different types of epithelial lining, nasal cavity. One is squamous epithelium, line the vestibule of the nose. Inside the ala is the vestibule of the nose where there is skin bearing area with, the hair bearing area, VBC, and that is squamous epithelium lining. And most of the nasal cavity is lined by pseudostratified ciliated columnar epithelium, and upper part of the nasal cavity, around the roof of the nasal cavity, is lined by a special type of epithelium. It's called olfactory neuroepithelium, where all the olfactory neuroreceptors or olfactory nerves receptors are lined there. So this is called olfactory neuroepithelium at the upper half or upper 1/3 of the nasal cavity. At the level of the supraterminate and above the supraterminate, this level. Now, we have in the nose also paranasal sinuses. And this is very important for exam. We ask this question in the exam. how paranasal sinuses drain. What are the paranasal sinuses? We also put this question in MCQ. So look at the picture here. We have usually two group of paranasal sinuses. One is anterior group, another is posterior group. The anterior group of paranasal sinuses comprises of the maxillary sinus, the frontal sinus, and enteroethmoid ear cells. The posterior group of paranasal sinuses comprises of the sphenoid sinus here and the posterior ethmoid ear cells. So if you look at the picture here, this is the frontal sinus, this area, here and here, and medial to the orbit or eye, these are the ethmoid ear cells or sinuses, and in the cheek here, below the orbit and above the tooth here is your maxillary sinus. If you look at the X-ray, you can see clearly there are some paranasal sinuses. This is the left maxillary sinus. This is the right maxillary sinus. And this is the orbit, middle of the orbit, these are the ethmoid ear cells. And here is the frontal sinus. If you do a CT scan of the sinuses, coronal CT scan, you can see clearly the left maxillary sinus, right maxillary sinus. Look at the multiple ethmoid ear cells. Multiple ethmoid ear cells. It just is medial to the orbit. So the anterior group of paranasal sinuses are maxillary, frontal, and anterior group of ethmoid ear cells, and the posterior group of ethmoid ear cells and sphenoid sinus. Now, how do they drain? In general sense, very simple to remember that the anterior group drains into medial meatus, and the posterior group drain into superior meatus. There are some exceptions like your sphenoid sinus don't directly drain to the superior meatus, rather it has separate opening to the spheno-ethmoid recess. But if you say in the superior meatus, we usually accept this question. We usually accept, okay. In general sense, the anterior group of paranasal sinuses, the maxillary, the frontal, and the enteroethmoid drain into the middle meatus. The posterior group of ethmoid ear cells and sphenoid sinus drain into the superior meatus. That is accepted. But if you know clearly, it is that the sphenoid sinus drains to spheno-ethmoid recess. What about the inferior meatus? Who drain to the inferior meatus? The nasolacrimal duct drains into the inferior meatus. So this is very important for your exam. This is very important for your MCQ as well, that how the paranasal sinuses drain. Actually, all the paranasal sinuses develops during the neonatal time, but the maxillary sinus is usually rudimentary at birth. When the facial skeleton is growing up, the dentition is growing up, so maxillary sinus is getting bigger and bigger. The other sinuses like your ethmoid sinus is usually bigger at birth. Sometimes frontal sinus may be absent, sometimes rudimentary. But the important part of the exam is how these paranasal sinuses drain, or drainage of the paranasal sinuses. That is important for exam. So as I said, the osteomeatal complex before. Now, if you look at the picture here, the sphenoid sinus is very close to the superior meatus. So they drain here. The sphenoid sinus, superior meatus. The maxillary sinus, the frontal sinus. Look at this picture here. Along the anterior border or anterior superior part of the middle turbinate, here is the axilla. Here is your drainage area of the frontal sinus. Look at the frontal sinus here. The frontal sinus drains directly to the medial meatus through frontonasal duct or frontal recess here. So, and it is very much gravity dependent, because as the sinus is above, so the gravity pulling the drainage very easily. But the problem is maxillary sinus behind lateral to this, it has got opening in the superior part. So for drainage of the maxillary sinus, it needs ciliary activity. With the ciliary motion, easily drains. And as you know, the narrow osteomeatal complex part, they blocks the easy drainage of the sinuses. As you know, the epithelial cells, so they drain middle meatus very easily. Now, so drainage of the maxillary paranasal sinuses, very simple, that in the intergrowth middle meatus, posterior growth superior meatus. What are the intergrowth? What are the posterior growth? That's important. Now, I'm just try to finish my lecture. What about the function of the nose? So, the nose has got tremendous functions, many functions. In the exam, we ask this question in the exam. Tell me about function of nose. In written paper, also we ask this question. So this is very important, that what are the functions of the nose? What hell it is doing? The first thing is, it is a passage or road for respiration, because we are breathing through the nose. That is your normal phenomena. But if the nose is blocked like that, we still can breathe through our mouth, but this is not normal. If you do mouth breathing, then we cut off your function of the nose. The mouth will be very, very dry, and also you'll get lots of bad smell from the mouth. It's called halitosis. So breathing from the nose is very important. Like when the child is born, he has to breathe through the nose, because mouth breathing we have to learn after, like swimming. So if the patient has got, or any newborn baby has got choanal atresia, that means posterior choana is completely blocked, then that particular child will have severe respiratory distress, because he or she doesn't know how to breathe through the mouth. So she has to learn mouth breathing. That's why the function of the nose is very important, that is a passage or road for respiration. That is very important. Number two is the air conditioning of the inspired air. That is very important, because the air is very dry. For the gaseous exchange at pulmonary level or alveolar capillary membrane level, the temperature should be very much optimum for smooth gas exchange. If we have a direct air coming for gas exchange, there will be lots of crusting. So the function of the nose is very important, humidification of the inspired air to supply optimum temperature air to the alveolar level for easy gas exchange, carbon dioxide and oxygen transmission. And who is doing that job is your inferior turbinate. In the inferior turbinate is very erectile, very vascular, and this turbinate has got subepithelial capillaries. When the air is flowing with the subepithelial capillaries, they humidify the inspired air. And we have actually nasal cycle. That means every patient has got one nose sometimes very blocked, a little bit blocked, other nose is open. After 4 or 5 hours, it changes. The other nose is blocked and another nose is open. So this is called nasal cycle. That means when the turbinate is working for humidification, the turbinate is very erectile, it's swell up, and that particular side is a bit blocked, and the other side turbinate is shrink, and he's taking rest. So the air is flowing through the opposite side very nicely. But eventually after 6 hours, 4, 5 hours, is vice versa coming up. So this is called nasal cycle. Now, what are the other functions of the nose? Is immunity. That means the nasal secretion contains immunoglobulin A, IgA, which can kill the inspired bacteria and viruses. So this is one of the functions of nose is immunity. Important function of the nose is, as you know, the smell. So it's the organ of smell, or olfaction is another important function of nose. What about the other function? Like it gives a resonance of voice, because if the nose is blocked, our quality of space is disturbed or hampered. If you close your nose and start talking, it seems that you are talking or some ghost is talking, like a robot is talking. So the nose is giving quality of voice or resonance of voice. The nasal mucosa, the mucosa lining of the paranasal sinuses, they are constantly transporting mucus with the ciliary activity, and that mucus is transported from the nasal cavity towards the pharynx to lubricate the pharynx, so that when you talk, we have a very weighty throat. Just you see in your examination center, your throat is very dry and you cannot even talk. Sometimes in the exam, if you are very much frightened, like in our English examination, FRCS examination, we have gallons of water bottle there with the glasses. The candidates are taking water. Still, their throat is very dry. If a dry throat, you cannot talk nicely. If you're scared, actually, sometimes you cannot talk. So the nose constantly giving mucus transport, lubricating the throat, so that we have got good swallowing and good space. And we also, the nose, from the expert ear, the nose can collect some moisture to prevent excessive loss. And also the nasal cavity, inside the nasal cavity, the vestibule has got some hair, and that hair is for actually, we can filter the big particles so that the harmful particles cannot get inside the nose and throat and airway. So this is a filtration of the suspended particles. And of course, the last of all is your nose is a part of beauty, or beautification. We know actually the person those who have a very beautiful nose, we like that. Like having the persons having beautiful nose, they usually go to showbiz business like your cinema, all these, actor, actress, they have a very beautiful nose. In old days in India, actually, one emperor actually, when anybody did or performed any crime or any sin, and that particular king chopped the nose to, rather than killing the person, chopped the nose to make him or her ugly. And from there, actually the the history of rhinoplasty coming up from India. So this is very important. So I think that is all for today's. What about the hello? Oh, a second. Function of paranasal sinuses is very important. Resonance of voice, again, the paranasal sinus has got usually no function. Sometimes they say no, we don't know actually what are the function of paranasal sinuses, but these are the recognized functions that they can do, they can contribute. One is resonance of voice, humidification of inspired air, protection of eye from any trauma, all these. And if you swim, actually, there is reduction of the weight of the skull, because there's the empty spaces. They can force the body and thermal insulation. So that is all. And smell actually through the olfactory nerve. All the roots coming up from the olfactory receptors, olfactory neurons, they cross the cribriform plate and coming to the olfactory bulb and then olfactory tract, and then to the frontal lobe. This is all about anatomy and physiology of nose. Thank you very much for your hearing. Thank you. See you in next class.